Ladies and gentlemen, good evening and welcome to the #1 show that provides you with the news and views of all things medical. Doctor in the House is back on board, and as usual, our theme is healthy lifestyles. Thank you to our cherished and much-loved viewers and callers, and also thank you for all of your letters and emails and calls. I know that you will enjoy the fantastic program that we have in store for you. As usual, it's the open forum. We are live on a Monday night with a rerun on Saturday afternoons at 1 p.m. on IBN. We are also streaming, so as I always say, you don't have to pay exorbitant cable rates because it's free streaming online on the IBN website. We're also streaming live on YouTube. The IBN Master is what you search for on YouTube, and you would be able to hear all of your Doctor in the House programs. So as usual, let's start with a bit of the medical news over the last week. Well, some general news. Congratulations to Sanjali Maharaj of St. Augustine Girls High School and Vishala Goon of Lakshmi Girls Hindu College, who both won the President's Medal and topped the CAPE examinations this year. This is a hat trick of wins in terms of the President's Medal for Lakshmi Girls. So it's the third consecutive student receiving the President's Medal. And out of 382 scholarships awarded this year, we certainly wish to congratulate all of the students and indeed their parents and teachers. God's blessings as well to some of the other winners, Joshua Manik-chan from Freeport, Matthias Rambali, both of them from my alma mater, presentation in Shogunas, and they did exceptionally well. Caitlin Lachu Rampasad and Savita Pari, and indeed their families, once more reflection of the faith and the discipline required to succeed. The Doctor in the House team would want to wish God's blessings in your future endeavors. Now, you would look at the scholarship list, and indeed at all levels of academia, and would have noticed over the past few years that girls have continued to outshine boys. And I thought that it was appropriate that the theme for International Men's Day, which has been held on November 19th since 1999, is Celebrate Men and Boys. Now, it was started by my older brother, who is a lecturer in history at the University of the West Indies, Jerome, to celebrate our father's birthday on November the 19th. So happy birthday to Dad, Reverend Daniel Tilak Singh. The objectives of International Men's Day include a focus on men's and boys' health, because another thing which is seen is that the life expectancy for men tends to be shorter than that of women, improving gender relations, promoting gender equality, and highlighting positive male role models, which of course some may say is a reason why we've seen such a problem with the crime rate, the scourge of crime. So it's an occasion in Men's Day. So on November the 19th, it's an occasion for men to celebrate their achievements and contributions, especially to that of the family. So November 19th started in Trinidad and celebrated in more than 60 countries worldwide on November the 19th. As I mentioned, the scourge of crime, unfortunately, continues unchecked locally with more than 400 murders so far for the year. And there was a reminder from my good friend as well, the secretary of the Psychiatrists Association, but Dr. Varma Diyal Singh, to remember that mental health issues are also affecting victims of crime. And perhaps we don't often bring that into the front burner when we speak about crime, but mental health issues like anxiety or depression can often, or post-traumatic stress, can often be seen in victims of crime. The whole idea of mental health was also brought out after the tragic suicide of a young university graduate from Princestown. And certainly our thoughts and prayers are with the family members, and may she rest in peace. Just a reminder that if you think that you may have issues with your mood, or you may be grappling with that black dog of your depression, some of the symptoms may include a lack of sleep, problems with appetite, a loss of interest or zeal in things that used to have pleasure before, low self-esteem, loss of memory or concentration, suicidal thoughts, feelings of hopelessness, helplessness, and worthlessness. That remains one of the illnesses, unfortunately, that we still have a social stigma attached to it, the whole idea of your depression. And seek help, seek help. Call Lifeline. There's a 24-hour toll-free hotline which is available for you or a family member at 231-2824 or 220-3636 or 800-5588. Lifeline 231-2824, 220-3636 or 800-5588. Lifeline, it's free, it's readily available 24/7. They have been fielding more than 4,000 calls per year from volunteers, and certainly we wish to congratulate them for the yeoman service that they continue to provide in the country. And of course, we're talking about crime and trouble in the schools too. On our last program, I always mention it on Doctor in the House that the idea of bullying was also brought to the forefront in the last few weeks. And I know the Minister of Education was wondering if whether banning camera phones would be a solution to some of the problems plaguing our schools. Now, admittedly, the use of the camera phones, they can be a distraction, especially if you're in class. Obviously, you don't want to be sending a WhatsApp message while your teacher is in front of the whiteboard. But at the same time, too, that may represent a rather simplistic approach, I would think. And whether or not banning the camera phones is going to make a difference, because certainly it's highlighting problems within the school system that need to be addressed. And unfortunately, many of the school children seem to be emulating some of the politicians, as we often find ourselves taking ringside seats in the mass media to the usual political shenanigans. And I know that the opposition will be locked soon in an internal election battle in the month of November, and lots of the toing and froing and threats of imprisonment. And let's hear what happens in terms of the politics. We're thinking about the Christmas season too, as we move in the constant feasting here. We moved from the holy time of your Diwali and food associated with that into Christmas. And many of the advertisements, unfortunately, have been taking the Christ out of Christmas. I'm already seeing ads with liquor-shaped bottles, so bottles of alcohol shaped like a Christmas tree, unfortunately. It was interesting to see when we're wondering about hard times and austerity measures and a need to tighten your belts, as we've been told, and yet our import bill for alcohol is $669 million for the year. That's phenomenal, just for alcohol. And we know that that remains one of the causes for many socioeconomic and psychological and physical issues plaguing the nation. Speaking about some of the holidays and some of the times that we'll be having over the next few weeks, V.S. Naipaul, the Nobel Prize laureate from Central Trinidad, who now lives in England, once wrote of the mimic men, and we still continue to be mimicking, as we're seeing so many of the ads are bombarding us for Oktoberfest, which is a German drinking holiday as well, another time when you might be overindulging and imbibing, and Halloween. So that Samhain time, not saying, so apart from the fact that it was a pagan holiday, Halloween and Oktoberfest, so very much westernized things, as if we didn't have enough issues with childhood obesity, alcoholism, and rotting teeth to grapple with. So over the last week, we were struggling with widespread flooding. There was widespread flooding nationwide. And I think that the media was quick to highlight, especially the social media, was quick to highlight a poor response by the authorities. In fact, we were even told that it was no big thing, but we saw those zones, those terrible zones of flooding. And I want to congratulate the superb relief efforts from this blessed national community. I mean, they were true heroes, and these are the heroes who should be getting national awards, like the men who braved the ravaging waters in Kaparu to rescue a pregnant woman. From a health aspect, from a health standpoint, a nation which is reeling from the effects of flooding must also bear in mind that there may be public health challenges, including sewage, chemicals, and waterborne germs that may be mixed there. There are also troubling reports about infected wounds. So I know that there was at least one drowning of a mentally handicapped man. We have to be vigilant about affairs of electrocution and some of the animals in water, mold and mental health issues that may be as a result of the flooding problem. A reminder that should we have any more of that, no diving or swimming in the flood waters. So it was advised by an engineer in the media to underwash and degrease all of the vehicles, especially if you drove through flood. And I wish to congratulate the members of the IBN team as they came fresh on the heels of a positive relief effort in the islands of Antigua and Dominica after the hurricanes. I wish to congratulate them for their local relief efforts, and indeed our good friends too. I know I know the leader of the pack there would be Inshon, but Dr. Amina Khan, I spoke to her about the medical clinic, which was held on Sunday. That was Sunday, October the 29th, and that was a very successful one at the Baraka grounds in Shogunas. I wish to congratulate all involved in not just the relief efforts subsequent to the flooding, but also the hurricane efforts in the rest of the West Indies. And I think it's a good time to acknowledge the brilliant work as well too from Mr. Akalu or Mr. Sheikh Lisha, who is also one of our firm fans and viewers on Doctor in the House. World Food Day was held on October the 16th, and we had a reminder too that farmers were urged not to sell flood-soaked produce at markets. Perhaps it's time too that we compensate the farmers adequately, especially in areas such as central, south, and eastern Trinidad that were ravaged by floodwaters. There have been numerous cases of leptospirosis. So this may be a rat or dog-borne infection. So it's a germ that is spread, and especially if you may have cuts or wounds that comes in contact with contaminated water. So if you drink water or you eat food that may have been contaminated, you may get leptospirosis that can be marked by kidney and liver failure. And in Puerto Rico, after Hurricane Maria, the death toll so far has been at 51, and there have been numerous cases of leptospirosis. So remember, that's something that we are seeing here too, and we usually see a surge in the incidence after the rainy season, and I expect so following the flooding. So be very vigilant about that, leptospirosis. Of course, around this time of the year too, a reminder about the flu season, which tends to start in the latter part of October in North America and Europe. Get a flu shot, especially if you're at risk. In fact, it's been thought that you'd want to vaccinate everybody over the age of 2, particularly those at risk with chronic medical illnesses, such as diabetes, cancer, or kidney failure. So if you're pregnant, persons at extremes of age as well, with weakened immunities, and healthcare workers. So get your flu shot in time. And of course, basic hygiene to prevent the spread of these respiratory tract infections that tend to be spread by droplets in the air. A 31-year-old man in Houston died of a flesh-eating bacterium, and that medical term is called necrotizing fasciitis, that can rapidly become fatal after he assisted in cleanup efforts in Texas following Hurricane Harvey. So that's something to also bear in mind, that infected wounds should be treated promptly and by a respected healthcare professional. It's been thought too with climate change that we'll also be seeing a lot more of these changes like flooding and hurricanes in the coming years. And it's been said in New York City that some of the flooding over the next 5 years would be expected. Maybe every 5 years that you'd be seeing severe flooding in New York. The Trinidad and Tobago Heart Foundation has been a supporter, if we just change the pace a little bit, has been a supporter of Go Red for Women, which is a social initiative designed to empower women to take charge of their heart's health. And I know that there was a fundraiser from the Heart Foundation last weekend. Just a reminder for women to look after their heart health. We know the month of October is sometimes referred to as Pinktober because of the plethora of pink ribbons that might be around as they seek to raise awareness about breast cancer. But it's also important to know about the #1 cause of death in the world: heart attacks and stroke, cardiovascular disease. And knowing your risk factors is the first step towards battling this hidden epidemic, or this epidemic of cardiovascular disease. And some of these risks include diabetes, high blood pressure, high cholesterol, a family history of heart disease, smoking, sedentary lifestyle, and obesity. Some medications and some medical illnesses may all increase the chance for inflammation to the lining of the arteries and subsequently cardiovascular problems. So knowing risk factors, just a reminder, especially on this healthy lifestyles theme. And I'm sure we'll be discussing this in time to come. As we go across to the sister isle, and I would also like to welcome our viewers in Tobago, so the sister isle. So I know that we have some firm fans, and now that we're also streaming live, many of those individuals are also interested on the show. The regional health authority there had to compensate a mother of a teenage stabbing victim. So a victim from an incident in 2010. Apparently the hospital in Scarborough discharged him despite the fact that he had a CT scan. So he's a victim of stabbing. He had a CT scan, and when he went home, he died a few days later. The post-mortem showed that there was trauma to his lungs, liver, and kidneys. So the judge there has ruled that his mother would be compensated following his death. Regionally, congratulations to a Guyana-born black businesswoman who has been named the most influential black person in the United Kingdom over the last week. And she has been very instrumental in launching the Brexit legal challenge. So that's the big thing when they voted to see if the United Kingdom would be leaving the European Union. We always like to talk a little bit about diabetes. And we know that we've spoken about type 1 and type 2 diabetes. There was a reminder in the last week by some British researchers about type 3C diabetes, which occurs after trauma to the pancreas, such as a pancreatitis. And just a reminder that many of those persons with this so-called type 3C diabetes may require a stronger medical intervention than type 2. So you've had a lesion, you've had an inflammation of the pancreas, a pancreatitis, and you become a diabetic. But frequently, those individuals are told that they may have type 2 diabetes. But persons with type 3C diabetes, so trauma or some sort of damage to the pancreas, or lesion on the pancreas, were twice as likely to have poor blood sugar control than those with type 2 diabetes, and indeed were 5 to 10 times more likely to need insulin, depending on the type of the disease affecting the pancreas. So, but just a reminder, it would be something to talk about with your doctor, especially if you think that your diabetes is not just due to things like obesity, a family history, but polycystic ovaries and so forth, that it may be due to a lesion, trauma, or damage to the pancreas. Type 3C. Speaking about diabetes, there was an interesting study looking at type 1 diabetics. So those are usually younger, lean persons who have some of the antibodies attacking the pancreas. So those cells that would normally produce insulin are depleted. And the type 1 diabetics, well, they need insulin from the outset. And many of the persons, especially if they're diabetic when they're younger, find that when they reach the teenage years, it's part of the teenage angst, that they find that they want to skip insulin. They may be depressed as well too, very frequently, but depression and diabetes tend to coexist. We spoke about that as well. And that can snowball into a slew of complications, including issues with the eyes, the kidneys, the nerve endings, and of course, heart attacks and strokes. Researchers looked at two groups of teenagers with type 1 diabetes. So one group, they gave them a financial incentive, $60 per month, so that's US, so that's in America, 60 US per month, to manage their diabetes well. So make sure that they're monitoring their sugars, make sure they're taking insulin, that they're doing blood tests and follow up with their doctors. And the other didn't get that cash incentive. And what they found is that the group with that cash at stake, 60 US per month, was nearly 3 times more likely to hit their daily goals for blood sugar levels. So that's interesting. Financial incentives, small, but for teenagers with type 1 diabetes, that group was 3 times more likely to meet targets. So that's interesting. And whether or not it would be applicable on a larger scale is yet to be seen. Similarly, a small American study showed that the older persons with poorly controlled type 2 diabetes, or found that they were struggling with their weight, they were obese, and we know that the whole idea of type 2 diabetes and obesity is that they are twins, they are twin epidemics. And in fact, diabesity is often a word that is coined to describe persons with both issues. And they had a reduced level of sugar at the brain, and that can lead to adverse problems in the brain, like memory issues. High intensity training. So if you're exercising, you're running, so you're trying to get in your cardiovascular fitness in, high intensity training for 12 weeks was found to increase the levels of sugar in the brain. And of course, that's a good thing because the brain requires glucose as a source of fuel. So if you're obese and you're type 2 diabetic, you have reduced levels of sugar in the brain, but that can be increased. So you can actually make your brain sweeter, if you wish, in inverted commas, by increasing the amount of aerobic exercise, running, jogging, biking, swimming, trying to increase that physical activity and dancing away from the sedentary lifestyle that will increase your chance for heart attacks and strokes. Going further to Canada now, a small study there as well showed that food products that claim to have reduced sugar or no sugar would be added, although they can be healthier and lower in calories, they can still have a certain amount of sugar, and some of it can actually be higher than the recommended levels from the World Health Organization. So although you're reading your labels, you're reading your packages, they're saying that there is no sugar that's added, or there's lower amounts of sugar, remember that they still have certain amounts that can impact on your glucose control and be contributing to obesity. So it's recommended as well to, in that small study in Canada, to continue having a diet rich in whole foods. Having more meals at home might also be useful too, instead of having meals at a restaurant. Fruits, vegetables, peas and beans, nuts, low fat and low salt, and of course, a supply of fish if you so desire. Staying in the theme of healthy living, persons with prediabetes and obesity in a study called the SCALE study showed 3-year improvements in weight loss and had an improved quality of life with a once-per-day injection. So it's not available here. This injection is called liraglutide, and once per day. So it's a drug which has been approved for weight loss in the United States. And they looked at persons who had that injection versus those who didn't. Persons who were obese and they were pre-diabetic. So they were not full-fledged diabetics yet, but they were on the threshold of becoming so. And they found that once per day, that injection was able to help them lose weight and was also improving quality of life. There was a meeting of bariatric surgeons recently that showed as well that perhaps the structure of hearts may be healthier amongst 51 patients who lost weight after gastric bypass and other forms of bariatric surgery. So we know that that is increasingly becoming a tool in the armamentarium to fight this obesity epidemic and to also deal with diabetes. So over the last week, there were some studies showing that there was an increased risk of early menopause among underweight women. So we want you to think about an ideal target weight. It's something to chat with your doctor about as well, that women who are underweight had an earlier menopause. And there was a lower risk for that in persons who were actually obese or overweight versus normal weight women. So up to 10% of women who experience an earlier age of menopause. So in Trinidad, that age may vary from, let's say, 45 to 55 years. And an earlier age of menopause, if you're underweight, may increase your chance for heart attacks and strokes. And it may also affect your memory, it may thin your bones, and perhaps may put you at an increased risk for premature death. So that's why that is important too. Premature menopause comes with subsequent medical problems. Cholesterol levels have started to fall over the last few years in the United States. But the British Medical Journal this week, so that's one of the top journals in the United Kingdom, following up 3,200 patients, showing that long-term statin use, so I know that lots of the callers and viewers are always interested about statins in the management of high blood cholesterol, but long-term statin use seems to be associated with an increased risk for type 2 diabetes in approximately 30% of persons at high risk. Now, this is not a call for you to stop your statin because, of course, the benefits of these drugs, and there are billions of patients worldwide who have been involved in studies and trials since statins have appeared on the medical market, and the benefits of the use of statins far outweigh risks, especially if you've had a heart attack or stroke, if you've had blockages in your arteries, if you're a diabetic, perhaps aged 40 to 75 years, if you are at an increased risk for having a cardiovascular problem, or if you have that bad type of the cholesterol, a low-density lipoprotein, which exceeds more than 190, that is a reminder that you may be one of the candidates to start a statin. So, but it's something to bear in mind that in persons who are taking especially higher doses of statins, that there's been definitely a link towards an increased trend for type 2 diabetes. So I'd like to say as well to a special good evening to my friend, Dr. Omardeen, Feroz Omardeen, one of the co-hosts on The Doctor in the House. He sent me an interesting message as well too this morning about healthy lifestyles and how some of the advice that we often preach and we often talk to patients about, we haven't been seeing it borne out in studies. In fact, a lot of the evidence seems to always be changing. A lot of the recommendations seem to always be changing. And we have seen that over the last few months, especially when it comes to advice about diet and healthy eating. And now we're seeing some of the recommendations. One must be vigilant about the use of certain medications. Cataract surgery now, so we move into the eyes now. That is the commonest operation done, I think, locally and perhaps worldwide. And one of the associations in the United Kingdom that normally would make recommendations for doctors and the public published guidelines about cataract surgery in the last week. An interesting observations in the United States, though, is that older women who had cataract surgery may actually be at a lower risk of death. Now, it was just an interesting observation, but whether or not it was due to the cataract surgery, maybe perhaps that if you have your surgery, you're less likely to fall. It might be a simple association like that. But they found that those women, especially as they were growing older, were at a lower chance for death. So in the United Kingdom, it has been estimated that perhaps more than 400,000 cataract operations per year are performed. And it was a reminder too that don't wait until patients are blind. So it's almost like a lottery where patients are often sent out letters and they are called in for their surgery. I know, unfortunately, I'll have a lot of viewers saying that they're waiting for operations in the public sector for years while they're slowly going blind. But one of the recommendations is that don't wait until that happens and the quality of life of the patient is affected. Cataracts, but just a reminder too that that's where the lens in the eye, so the eye is like a camera, and there is a lens there, and that lens in the eye becomes cloudy, and it leads to blurry, misty vision and sight loss. It can start in one or both eyes, and normally maybe happening as a result of aging. That risk is also accentuated in diabetics, persons with diabetes. And it can be treated by replacing the cloudy lens with an artificial one. So it's one of the commonest operations done worldwide, and recent recommendations try to operate at perhaps a speedier rate than is occurring. We usually like to mention a little bit of cricket, and the West Indies cricket team has been thrashing Zimbabwe across there in a 2-test series. I would like to congratulate my friend Junaid, who is one of the stalwarts here at the IBN studio, and the Pakistani team. So he supports the Pakistani team, and they whitewashed their Sri Lankan opponents. I know the West Indies team is also due to play a test series there, as they have had a welcome return to test and international cricket in Pakistan. And speaking of Zimbabwe, the World Health Organization revoked the appointment of their president, Robert Mugabe. So can you believe the WHO appointed him as a goodwill ambassador? We've heard so many negative things about the president across there, so at least in the local and international media. And Zimbabwe has been dogged by a deteriorating health sector, terrifying rates of HIV and AIDS, and a litany of human rights abuses. And they appointed him a goodwill ambassador, so the WHO. But apparently it's been revoked, at least over the last week. And in closing this segment of the show, it's the Medicine Corner. And I'd like to talk a little bit about a burgeoning epidemic. We've spoken about the issues of obesity and diabetes and this whole problem of the metabolic syndrome, inclusive of fat around the tummy, fat in the liver, polycystic ovaries, high blood pressure, high cholesterol. Those are separate epidemics. But an opioid epidemic has started arising in the United States and perhaps creeping into places such as Trinidad and Tobago. US President Trump last week declared that this was a public health emergency. So these are drugs like morphine, pethidine, codeine, so drugs which are traditionally used for pain and sometimes prescribed at levels of the accident and emergency. And this being said that it is now a public health emergency, but opioids like heroin and morphine and so forth, it means that government agencies in the United States will be able to put more resources towards fighting the epidemic. There were 64,000 deaths as a result of opioid use last year. 64,000 deaths in the United States. Now, just say no is one of the things that we would remember. Well, when I was growing up, you would always hear that about drugs, just say no to drugs. But whether or not that too is a simplistic approach to the opioid epidemic, it's difficult as well too in terms of an addiction, because it's a disease when you're addicted to drugs or alcohol, and it involves issues with the brain. Might have been useful in the 1980s, but maybe not to change policy. Some of the critics are actually saying that the president did not make funding available for treating persons who are addicted to things like heroin, and it didn't make one of the antidotes. So if you have an overdose, there's an antidote that can be administered to patients like that, especially if it has affected their breathing and they've slipped into a coma. And some of the funding should be used to address critical needs like the provision of this antidote to hospitals there. There's a strong overlap as well too between mental illness and substance abuse, because it's been said that more than 40% of persons who abuse or misuse substances are also depressed. So that means that treatment should be focusing on both the psychiatric aspect and the physical aspects. Unfortunately, doctors are caught in what was termed on Stat News a moral cage fight. We don't want to feed addiction, so we don't want to be prescribing some of these drugs. But at the same time, we have to alleviate suffering. So we have to try to get some form of pain relief. And I think locally, a classic example is when we see persons with sickle cell. And that can be very painful, especially when they get a crisis. They're frequently admitted to accident and emergencies. They come to my ward at San Fernando General Hospital and nationwide, seeking not just pain relief, but relief from the crisis. And sometimes they have infections or they have issues that may have been a trigger for that. And many of them find that they may become addicted to some of these opioids. We sometimes see it even with heart patients. They may find that these drugs which are regulated. These are classified as dangerous drugs. They're strictly regulated in a hospital and even in a private pharmaceutical environment. But it's a reminder about a new epidemic which is arising, a public health emergency in the United States, the abuse and misuse of opioids. Let's have a quick look at this statement from U.S. President Trump.
Effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis. I learned myself. I had a brother, Fred, great guy, best looking guy, best personality, much better than mine. But he had a problem. He had a problem with alcohol. And he would tell me, don't drink, don't drink. He was substantially older, and I listened to him, and I respected, but he would constantly tell me, don't drink. He'd also add, don't smoke. But he would say it over and over and over again. And to this day, I've never had a drink. And I have no longing for it. I have no interest in it. To this day, I've never had a cigarette. Don't worry, those are only two of my good things. I don't want to tell you about the bad things. There's plenty of bad things, too. But he really helped me. I had somebody that guided me. And he had a very, very, very tough life because of alcohol. Believe me, very, very tough life. He was a strong guy, but it was a tough thing that he was going through. But I learned because of Fred. I learned. And that's what I think is so important. This was an idea that I had, where if we can teach young people not to take drugs, just not to take them. When I see friends of mine that are having difficulty with not having that drink at dinner, where it's literally almost impossible for them to stop, I say to myself, I can't even understand it. Why would that be difficult? But we understand why it is difficult. The fact is, if we can teach young people and people generally not to start, it's really, really easy not to take them. And I think that's going to end up being our most important thing.
But just to remind today about some of the dangers, and I'm glad that he touched about some of his personal experiences too with his brother and grappling to the curse of alcoholism. Let's take a short break, and when we return, we'll take your calls on Doctor in the House. Stay with us.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
For the everyday lowest prices on all grocery items, trust Low Cost Supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high-quality meat cuts, and a warm and friendly service. Low Cost Supermarket, Sun and Main Road, Cunupia.
Reduce sugar chubby with the same great taste. Lots of magic fruity flavors, drink the more healthy way.
It tastes so yummy, chubby, chubby.
25% less sugar chubby. Be active, be healthy, drink lots of chubby. Kick you from sugar chubby, jumping rope, running races, have fun.
It's so yummy, chubby.
Drink the more healthy way.
Welcome back to Doctor in the House. So after a little bit of the negative news, I know that I delved a little bit into some unfortunate stories in the first part of the show, but we usually have a lighter side. And it's just a reminder to us, we move into the feasting time, we move into Christmas, it's just a reminder to be safe in food handling and to be vigilant at the dinner table. Let's have a look.
Excuse me. Are these all right?
No, I do apologize.
It's okay.
Trouble ahead there for Mr. Bean, I'm sure. So it's just a reminder, but what a good clip and a reminder as well, too, about being careful in terms of food safety, food handling, and hygiene. So I'd like to also thank the members of our studio audience here, Mr. Sat Budram, Dr. Neela Ramdas Tilaksing, and a special guest as well, too, Mr. Gangadeen, Randy O'Donnell, who is one of the leaders at CAL, and I would like to welcome him too to the studios of IBN, and blessings indeed to all members of the family. Birthday greetings too, as I mentioned, my father will celebrate his on November the 19th, and another firm fan, friend, and viewer, Dr. Faria Mohammed from Charleville. So the dentist from Charleville there at Sumaria Trace, special hello and happy birthday to you, ma'am. And indeed, Dr. Victor, who is my brother from Chase Village, a close friend and brother almost to us, and he celebrates his on the 30th of October. My good friend too, Mr. Singh from Palki's restaurant, Mishpreet Singh, had his birthday on the 29th of October. And a special hello to Lazina Khan, the Khans from Bank Village, who are also viewers and fans of the show. She always has something to say about the tie or the jacket or so, and she always likes them all, I'm sure. So a special happy birthday and good evening to that family. Right, so the phone lines will soon be opening up. It's the open forum. The theme is healthy lifestyles. This is your chance to call in. So if you'd like to share any thoughts or ideas of a medical nature, we will take a short break. And when we return, the calls will be available. And a reminder too as well that when you're patched into the studio to mute your television set and listen on the telephone when you're patched into the studio, because otherwise you may find that it becomes rather confusing to have a conversation. So we'll take a short break, and when we return, it's the open forum in full flight on Doctor in the House. Stay with us.
At times I feel that the sun is hidden by a hazy sky.
A God's gift brought straight from the farm to your plate. Jazza Rice, with its premium range of basmati rice, helping you prepare your perfect, mouth-watering dishes just as you planned. Jazza Rice, blessings in each plate.
Every now and then we need.
This is a Pakistani product, and all over the world, at least try it once. And if it's good, please let us know. We need your encouragement.
Just a little time to breathe.
Milkana butter, an experience for your taste buds. Smooth, flavor-filled, rich, velvety butter. Milkana butter for cakes, pastries, pies, or just place it in any of your favorite dishes and add that rich buttery taste to all your meals. Why choose another? Look for the butter with flavor, the butter with the creamy richness in taste. Milkana butter, distributed by NM Ghani 2003 Limited, number 1 Industrial Lane, Champlain.
Welcome back to Doctor in the House. So it's the open forum. It's your chance to call in and ask some of the medically themed questions. The phone lines should be up on the screen shortly. And so as a reminder to when you're patched into the studio to mute the television set and listen on the telephone. So in the interest of time too, we would like you to ask, so I may not be able to have a long chat on the phone because we'll be trying to encompass a lot of questions. I'd like you to ask a question, then you can listen on the television set afterwards. And a reminder as well, too, that although we're live on Monday nights, there's a rerun on Saturdays at 1 p.m., so you can tell your friends and family members for that. And we are streaming live on the IBN website and on YouTube as well. There is the IBN Master is where you're searching, and you'd be able to get not just this episode, but also past versions of Doctor in the House. So the numbers are 645-4426 or 663-8373. And before we take our first caller, so one of the messages I've had in the last week has been about pre-diabetes. So that has been a creeping epidemic as well. I've been using that term throughout the news. Pre-diabetes, just standing on the threshold of diabetes. And we spoke about that as being one of the issues. It's almost like the tip of the iceberg before someone starts running into issues with their blood sugar. So we'll get back to that because I understand that our first call for the evening is ready from El Dorado. Good evening, and thank you for joining us. Hello?
Hello?
Thank you for joining us, ma'am. You're on the air.
Yes, thank you. What I would like to clear up is a relative of mine, she has severe back pain at the tail of her spine.
Right.
And she said that the doctor said her spine dropped. But I cannot figure out how your spine could drop.
Right.
So could you explain that, or is the doctor misleading her?
Okay, thank you very much for that. Since it's one of the commonest problems that persons may seek medical attention, lower back pain, and there are many reasons for it. In terms of the spine actually dropping, it may be difficult, but to actually say, I don't know if the doctor had the benefit of maybe looking at an X-ray or looking at an MRI. But what can frequently happen in the lower back is there may be wear and tear. So it's an area that tends to take a lot of pressure, and there are often degenerative changes or wear and tear to those bones, the discs. And sometimes they may actually press on a nerve, and the persons may find that that nerve that travels down the leg, the sciatic nerve, may cause a lot of pain radiating from the buttock down to the leg, and it may be associated with numbness, pins and needles, burning and lancing and so forth, and may actually cause weakness. So persons who may be of advancing age, persons who may have had a history of cancer, if they are losing weight, if they have a low blood count, if they have issues where the spinal cord may be compressed, those are individuals who should be sent for scanning, some sort of imaging. And preferably, I would think, if you're thinking about spinal cord issues, you want to do the magnetic resonance imaging, the MRI. That is the best test for that. So lower back pain frequently is due to wear and tear. It may be muscular, it may be due to arthritis. Women, especially after the menopause, may find that they are prone to thin bones, and there may be actually fractures in your back too. And these can subsequently cause not just pain, but also nerve root impingement. So in terms of whether or not the spine will drop, I mean, that's obviously a local term. Perhaps the physician was referring to wear and tear, some of the changes that he noticed. Maybe the bones were starting to get closer, and maybe they were pressing on a nerve, and some of the symptoms were associated with it. But I wish you all the best, though, at least in alleviating that relative's pain. Some of the simple pain relief medications may be used, and of course there are physiotherapy options, surgical options too, and that may fall under the realm sometimes if it's not being adequately addressed by your GP or your primary care physician. It may be referred to a neurosurgeon or a spinal surgeon for further management. Right, so let's take another call. Good evening and welcome to Doctor in the House. Thank you for joining us.
Hi, good evening, Doc.
Thank you for joining us, sir. Welcome. You're on the air.
Okay. All right. Two quick questions.
Sure.
I am taking statins,
Right.
which is Presto 10 mg.
Okay.
3 times a week, like Monday, Wednesday, Friday. You spoke earlier on about developing type 2 diabetes. How will that affect, that's the 10 mg, how will that affect me?
Okay.
And yes, so that's it. Yeah.
Thank you very much, because I know a lot of persons. In fact, it might be one of the most commonly prescribed drugs nowadays. So statins used in the management of high blood cholesterol, and also used, as we said, to protect your heart and lower your chance for cardiovascular problems. Now, the benefits of statins far outweigh the risks. We often hear persons speak about maybe muscle aches and pains. A lot of individuals have maybe irrational fears about liver damage when it comes to statin use. Many of these would be anecdotal. You've heard from somebody that, oh, you know, you have to be watchful about those drugs. But we are seeing a very real risk for new onset diabetes. But what has been seen in a lot of studies is that higher doses of statins, and that particular brand is called rosuvastatin, so that's the other name for it, rosuvastatin, maybe higher doses, so persons who may be taking, let's say, 40 milligrams per day, because you're on 10 milligrams maybe every other day. Now, that's another issue too, whether or not you're going to maximally get the benefits of statins if you take them every other day is something that maybe is fertile ground for research. So I can't actually say whether or not you're going to benefit from it. It's something, though, to chat with your doctor about as to the reason why he or she has prescribed that statin for you. Because if you're diabetic, so if you've had a heart attack or stroke in the past, so let's say you're 40 to 75 years old with a history of type 2 diabetes, if your low density lipoprotein is more than 190, or if your doctor has deemed you very high risk, you may find that the statin is going to be more beneficial rather than a small chance for harm. But what I would advise is if you're at risk for diabetes, so if you're obese, if you have a family history, you have a sedentary lifestyle, women who have had a history of gestational diabetes, girls with polycystic ovary syndrome, if you've had big babies or sudden unexplained stillbirths, if you have fatty livers, so if you've done an ultrasound and a doctor has mentioned that term, a fatty liver. So that plethora of risk factors for diabetes, it makes sense if you're using a statin to engage in healthy living. So a good diet, low carbs perhaps, you want to avoid the sugars, and as well as exercise, 30 to 60 minutes per day of running, walking, jogging, and so forth. So ensuring that you fight the risk for diabetes. So ensuring that although you may have a predisposition, let's say that you have a genetic predisposition to diabetes, it doesn't mean that you're going to allow genes to run your life. In fact, one of the famous diabetes specialists in the United States used to say that you consider genetics like a loaded gun, but your lifestyle pulls the trigger. And in the same way, if you're using statins, so if your doctor has recommended statins for the management of high blood cholesterol, you want to make sure that you lower that risk, you mitigate that risk for diabetes, especially if you're on high doses. You're still on a very low dose. It's a good statin. It's a good medication. You're on a low dose, and I'm sure you're going to garner some sort of benefit. But there are pros and cons. There are trade-offs to any medication that you're using, and it would be part of your discussion. And I'm so glad that you called in, because it should form a part of your discussion with your physician prior to prescribing a statin. So two excellent questions to open the batting so far on this segment of the show. Let's go back to the phone lines. Good evening and welcome to Doctor in the House. Hello?
Hello?
Hello? Yes, sir.
Yes.
You're on the air. Thank you for joining us.
Yes, I'm calling to find my wife suffers from overactive thyroid.
Right.
And she's been on a medication called Neomeprazole 5 mg, which is definitely not available in Trinidad.
Sure.
The thing is, she had relatives who have had their thyroid gland removed.
Yes.
How does that impact on your normal daily living?
Right. Thank you very much. And that's another one of the superb questions which I've grown accustomed to on this show, that the viewers and the callers are always so insightful. So I'll address the issue of the thyroid and the management of a hyperactive one shortly. But we go across to the west to Diego Martin. Good evening and thank you. Welcome to the show.
Good afternoon, Doctor.
Thank you for joining us, sir. You're on the air.
Thank you for, it's the first time I'm watching, it's the first time I'm watching your program.
Yes.
You know that you teach us how to, to manage our eating and et cetera.
Yes.
But what it is like, sometimes you think about a person, what mightn't be able, to, even though with the medical, this is the thing about, that's what I'm calling.
Yes.
This is some way that we could, for these basic things in the country.
Yes.
That
the affordability of some of these things are not available.
Because
yes.
Everything is doctor. You're talking there, but you're still telling us how to,
yes.
to control it.
Good
but
point.
The bottom line is, sometimes a person, you know the money going.
True.
And I believe, from the way you speak, if the doctors can ease up on some things, or sometimes let the patients come in and assist them in some new way or something.
Certainly.
And even with the government.
Absolutely.
People put tax, and doctors, I know it is a hard study.
Yes.
I know you all went to school and whatever, you all take your own thing. But,
so in terms of the cost factor,
I'm not talking about politics. No, I'm not talking about politics because... Yeah,
you will have another opportunity to talk politics, yes.
Have a nice evening. But, I think about the person, you know what I mean?
Yes.
Sometimes I ask the doctors, can ease them up some, we talk to one...
Your point is a valid one, sir. Thank you very much for that.
You know what I mean?
Yes.
I'm not just to the Minister of Health.
Yes.
Yeah, inshallah. So
thank you very much. And I certainly want to applaud that caller who is bringing up some of the socioeconomic aspects of dealing with healthcare, some of the aspects in terms of the financial problems facing the country. These austerity measures are affecting the health of the nation. And perhaps I think, and he mentioned about at a governmental level, that perhaps we should be thinking about tightening some of the laws and legislating against perhaps sugar-sweetened beverages to curb childhood obesity. That might be one of the aspects. So I know that the Minister of Health has been trying to tackle childhood obesity at the levels of the school and trying to provide healthier school feeding issues. But what about things like green spaces? Places like in the capital city or in some of the major towns, as a result of urbanization, persons don't feel safe, but they're not safe. We're speaking about the scourge of crime. So persons are no longer able to exercise. The guys on the block are no longer able to play football or cricket. You're not playing that on the gap anymore. Some of the foods which are healthier, like the fruits and vegetables, they're not available. They're not affordable. So as well, perhaps after the flooding, we may see a rise in prices. So those are some of the aspects too. Apart from trying to keep healthcare costs down, those are some of the simpler aspects and simpler tools towards tackling obesity. So it's a good point, and it's a valid one. It's taken. Back to the caller who was wondering about the hyperactive thyroid gland. So the thyroid gland is a butterfly-shaped gland in the front of the neck that releases hormones. And hormones are messengers which are produced by these glands. They're transported in the bloodstream and exert effects on target organs or tissues. And the thyroid gland regulates things like weight, heat, appetite, how you feel in general. And when it's hyperactive or overactive, persons may find they lose weight, they're sweaty, nervous, trembling, their heart is racing. They may get a diarrhea. Women may find that their periods are scanty, and their moods as well too may be very labile. That means that they may be changeable and changing all the time. So very common, and we usually see it in women. Women are about 10 times more likely than men to have issues with the thyroid gland. And there's a strong family history often associated with thyroid problems. Now, his wife has been using a drug called carbimazole, which is widely used for hyperactive gland. Surgery can sometimes be an option, but it's usually reserved for persons who have a very enlarged gland in the neck. So in men, it may be seen below by the Adam's apple. So it's usually in the front of the neck, butterfly-shaped, as I mentioned. And if it's very enlarged and it's actually affecting breathing or swallowing, sometimes the doctor may actually send you for scans and imaging. He may do a test and say, well, okay, I'm not too happy with the result of this test. So, and there may be growths or nodules. So this month of October is World Thyroid Nodule Month as well. So we were talking about breast cancer awareness, but October is also Thyroid Nodule Awareness Month. So if the doctor thinks that there may be a suspicion of cancer, he may recommend surgery, or if it's hard to control. Some persons just don't like the appearance, so they think that this enlargement of the thyroid gland or goiter is something that they're not too comfortable with, and they would rather a surgical treatment. Of course, surgery comes with its own risks. The risk of bleeding, the risk of infection, and sometimes there may be even damage to some of the smaller glands near the thyroid, called the parathyroid glands, or they may actually affect a nerve that controls the voice box and affects speech. So there are pros and cons too. So just as we were talking about statins for the management of high blood cholesterol, there are pros and cons when it comes to doing something like a surgical procedure for somebody with a hyperactive gland. Of course, if you remove a part of the gland or you remove the entire gland, you will then find that you're underactive then, and you may need to supplement that with thyroid hormone. So a thyroid hormone replacement then is necessary for an improved quality of life. So pros and cons, and there are no right and wrong answers when it comes to it. There's even a third form of treatment called radioactive iodine, where you may swallow a capsule or a drink to actually burn out the thyroid gland. And that's actually one of the first lines of attack in the treatment of a hyperactive thyroid gland in places like the United States. But usually we would start with medications, those drugs like carbimazole, for about a year to 1.5 years, and then afterwards you step up to considering another form of treatment. But I certainly wish you and your wife all the best. Thank you for sharing that with us. We return to Central Trinidad. Hello, good evening, and welcome to Doctor in the House. Hello.
Hi, good night, Doctor.
Thank you for joining us, sir. You're on the air.
Okay. I would like to commend you for taking your time to come and educate the public and your expertise.
Thank you, sir.
I would also like to say a special hello to your in studio.
Yes.
But the thing about it is that I have a problem. The thing about it is that I snores. My wife has a problem with me snoring, but I don't know if I snore.
Right.
Well, normally she would tell me, look, stop snoring, or she would get up and go in the next room. How can you help me with this problem that she says I snore, that even the neighbor across the road can hear me at night and it's quiet. So Can you share some advice?
Thank you for taking the time to call in, and we certainly appreciate your warm wishes. Snoring can frequently be one of the symptoms that persons will actually mention to the doctor, and there are many reasons for that. Some persons find that they snore more, especially if they're very tired, they're very jaded. You may find that you're snoring, but there may be medical causes, and chatting with an ears, nose, and throat specialist is sometimes an option. Sometimes one of the first steps towards getting to the bottom of it and getting to the reason for the snoring. Persons who find that they may be overweight, or persons who have an underactive thyroid gland, or they have misuse in terms of their nose and throat, the ears, nose, and throat, may actually find themselves at risk for obstructive sleep apnea. So that's a medical term in which the neck circumference, or the width of the neck, is very large, and it's obstructing the free flow of oxygen at night. So you're sleeping, but you may find that you're not getting enough oxygen. You're tired the following day. Some persons may find that it actually affects their heart rhythm. Sometimes issues with breathing, and it sends up your blood pressure too. So weight loss might be one of the first things, especially if you find that you're overweight or obese. You may find that you want to tackle the idea of possibly obstructive sleep apnea. There are sleep studies as well too, which can be performed in order to diagnose this, whether or not that is the issue. But it's a difficult thing. I know that there are all these strips that might be available over the counter, these things which are marketed in order to help your breathing and to help with the free flow of air through the nasal passages. But whether or not that is going to help, so is a matter. So I think medical science is still trying to find simpler answers, simpler solutions to the common problem of snoring. And we know that apart from the fact that your spouse or your partner may be struggling at night, many persons find too that they may not be getting a refreshing or improved quality of sleep when they snore. So especially if the cause is obstructive sleep apnea. So you may want to consider chatting with your primary care doctor, simpler measures such as weight loss, if it's warranted, seeking a review by an ears, nose, and throat specialist. So of course, one of the disclaimers that we mentioned at the start of the show as well is that we're not attempting to diagnose a medical illness here. We're just thinking about throwing out thoughts and ideas to persons, and hopefully this can lead you in the right direction. All right, so we go to the East. Dabadi is on the line. Good evening and welcome to Doctor in the House. Thank you for joining us.
Yeah, thank you for having me. I was recently diagnosed. I did an MRI on the right knee.
Right.
And I have 2 tears meniscus in and out on the right knee, and I get a lot of pain in the knee.
Right. Okay, so I'm sorry to hear about those tears there. So once more, I would expect that some of the symptoms, apart from pain, it might have included stiffness, maybe some swelling, problems with walking. And those are some of the changes that can be seen with wear and tear or as a result of trauma, especially if you have done an MRI scan. I would assume that your doctor who sent you for that, whether your GP or perhaps an orthopedic surgeon, so that's a specialty of medicine which is involved with the muscles, bones, and joints and movements, the orthopedic surgeon would want to have a review of that MRI and see. Most of these cases, you wouldn't want to rush into surgery, but of course I wouldn't be able to give a judgment since I'm not privy to your results. But simpler measures such as pain relief, you may want to think about anti-inflammatories, because if that joint is very inflamed, simple anti-inflammatories may be a good step. Once more, weight loss. So this epidemic of osteoarthritis is tied into obesity as well, because you're going to be putting a lot of pressure on the knee. And persons may also be referred, just as we spoke a bit earlier about lower back pain, you may be referred for physiotherapy. So there are certain knee strengthening exercises that can also form a part of your management before you consider thinking about surgery. Sportsmen, unfortunately, especially with some major tears and ligaments or to the meniscus, sportsmen may find that they may require operations, and these often need fairly lengthy physiotherapy and rehabilitation measures subsequently. But I wish you all the best for that. And it's a common issue. Many of the persons who actually have knee pain, it's because of arthritis, because of osteoarthritis as a result of wear and tear to the joints. So you may find that padding surrounding the knee joint, that padding, the cartilage is worn away. Sometimes when you look at the MRI or you look at the X-ray, you find that the bones have become actually closer to each other, and those are some of the changes associated with degeneration to that knee joint. So we spoke in the news about persons who were being sent for cataract surgery, but actually knee replacement and hip replacement surgeries are fast becoming very common in the world. So the phone lines are burning up, and we stay in the East, this time in Arima. Good evening and welcome to Doctor in the House.
Hello, good evening, Doctor.
Thank you for joining us. It's a pleasure to have you.
You're welcome. My husband has a head cold, bad head cold.
Right.
His nose stuffy, and the eye would run water, the nose run water. I would like to know what causes that.
Okay. Thank you very much for that. So it's the open forum of Doctor in the House, and the phone lines are on. Before I answer that, let's go to Tunapuna. Good evening and welcome to the show.
Hi, good night.
Hello, you're on the air. Thank you for joining us, ma'am.
Good night. I have a problem.
Yes?
My problem is sweating.
Sweating?
Sweating.
Right. Okay.
Water running down.
Right. And that has been ongoing for a long time. You've had it for many years?
About 2 to 3 years.
Okay. Have you done any tests, or have you seen any doctors so far for that?
Well, when I went to the doctor, he said that it's something to do with age.
Okay. All right. Thank you very much for that. So our caller from Arima was asking about her husband, and it sounds like he actually may have an infection to the sinuses. So the sinuses affecting the head and the skull. So those are spaces that might be found in the skull and can sometimes get fluid. It could represent one of the complications following a virus. So some of the viruses, and I know we've had a plethora of cold and flu viruses around now following the August holidays. And it can result, these may result in air infections, chest infections, and trouble to the sinuses. You may find that your nose is stuffy. There may be a nasty smelling, so a discharge from the nose. There may be fever and pain as well too if you're pressing across the face. And it may warrant antibiotics if you're thinking about a secondary bacterial infection. So antibiotics are not used for viruses. So I want to emphasize that. So on the show, especially since we're seeing so much resistance to antibiotics are reserved for bacterial infections. So I would advise to chat with your doctor, have a proper evaluation, and see whether antibiotics may be warranted, especially if it's been lingering for a long time. Perhaps it's not an infection. Perhaps there's another reason there in which there may be an inflammation or some other change. There may be x-rays. Some persons are sent for scans, such as CT scans or even MRI scans for further evaluation of those symptoms. So although you're assuming that it's due to a cold, you're assuming it's due to some sort of infection, there may be something more that is brewing, something more that is lingering, and it warrants further testing. In terms of sweating, there are some medical reasons for that, but very frequently we may find none. There are some of the hormones that may be high. A few calls back, we spoke about hyperactive thyroid gland, and heat intolerance and sweating may be some of the commonest symptoms. And certainly making sure that the thyroid gland is not overactive may be a good first step. There are some of the other hormones. There are small glands above the kidneys, but the adrenal glands that may be associated not just with sweating, but headaches, a high blood pressure, anxiety, your heart may race because of high levels of adrenaline. There's some medications maybe make you sweat. If your blood sugar is falling, you may also find that sweating is one of the symptoms. Anxiety, and sometimes there may be actually a misuse with the sweat glands and the nerves supplying the sweat glands. Unfortunately, it remains one of the devilishly tricky things to actually treat and approach. But starting with simple blood tests, I think, is a good start. Chatting with your doctor, maybe perhaps thinking about seeing a skin specialist, a dermatologist, might also be on the cards for that. So we go to Central Trinidad once more to Shogunas. Thank you for joining us. You're on the air.
Hi, good evening.
Thank you for joining us, ma'am. Hello.
I have a question in the sense that I would like to find out if it is you're a bit overweight.
Yes.
But there is a constant, I've been told that I have acid reflux.
Okay.
However, from time to time I get this chest pain, and ever so often when I go and I take an ECG,
right,
the ECG comes up normal.
Okay.
So I just wanted to know, like, what test would you recommend that I take so I can see if there is a problem like a clogged artery or something going on with the heart, because ever so often I get the racing of the heart as well. So I'm a bit scared about that. So I just wanted to know what test I can use. Right. I'll listen off air.
Thank you. Thank you for that call. And that's a very insightful question, especially since we're seeing a lot more of that. So in fact, it's been said that, I remember one of my lecturers in England would say that if he had a penny for every person who presented with chest pain and thought it was acid reflux and turned out to be heart problems, he would be a millionaire. That it is so frequently misdiagnosed. Now, of course, it may well be due to acid reflux, that persons may find that they get a burning in their chest, the so-called heartburn, bitterness or sour taste in your mouth, and you may find that it's exacerbated or worsened by certain foods or medications. So it can well be due to acid reflux. And persons who find that they may be overweight or maybe obese, they are at an increased risk for acid reflux. And their symptoms improve when they lose weight, or with simple measures like with their diet, simple dietary adjustments. or medications to also block the production of acid. So there are remedies in order to deal with acid reflux. But you are thinking along the right path, that just in case that it could be something else, especially if you're getting chest pain and your heart is racing, you may want to do some further testing apart from just an ECG, which has been known, while it's an excellent tool for somebody who is presenting with a chest pain, so it's not a be-all and end-all in the evaluation of heart disease. You may want to chat with your doctor about perhaps doing a stress test, which is a treadmill test if your doctor thinks that you may be a candidate for that. There are scans on the heart as well, too, that may be done, an ultrasound of the heart that can be done at resting and following exercise on the treadmill. So if your doctor deems you safe to do that, and later on, and the last step, the last phase in your management may be an angiogram. So that's the test where there's an injection of a dye to look for blockages, so-called clogged arteries, as you mentioned. And these can then be managed appropriately. Not everybody needs to have these tests. So, of course, if your doctor thinks along the line of acid reflux, you may want to send you for an investigation which involves a camera to look down at the stomach, the endoscopy. He may want to send you as well, if it's not acid reflux. Persons who may be overweight may find that their symptoms are due to gallstones, stones in their gallbladder, and that pain may be triggered by the consumption of fried or fatty foods. So frequently there are many reasons for this, in summary, many reasons for chest pain, ranging from issues with the heart, the lungs, the stomach, the gallbladder, muscles and joints and so on across the chest wall, anxiety and stress. So amidst those reasons, you want to exclude potentially life-threatening ones. So starting off with simple investigations and then stepping up based on your feelings, based on your blood tests, because your doctor will also be monitoring things like your cholesterol, he'll be monitoring your blood pressure, your sugar level, just ensuring that you are not at risk for heart disease as well. Right, so we go to Valsane. Hello, good evening, and welcome to Doctor in the House.
Hello, good evening.
Thank you for joining us, ma'am. It's a pleasure to have you.
Thank you. A pleasure to listen to this program as always.
Thank you.
You just made a comment concerning the increasing volume of orthopedic surgery, mainly hip and knee replacement surgery.
Sure.
And I would like to use your program as a forum to enlighten the Ministry of Health and the NCREG, who I am sure are listening to this program.
You are welcome.
Concerning the recent mass surgeries that were done at the Herculean complex called Walk Maryland, where a volume of knee and I understand hip surgeries were performed.
Right.
Now, kudos that these doctors gave us their time and so on, but there's a bigger picture involved here. There was a program, and I'm saying was, but I am not aware that it has gone to was, okay? Because we have never been categorically been informed by the Ministry of Health that this program is no longer in existence. It is called the EPP program, External Patient Program. And you had to register with the program by the Ministry of Health in order to get particular medical assistance, whether it was or dialysis or knee surgeries or whatever it was. Anywho, after many attempts trying to get through to somebody at the ministry, I eventually had to get through to the ministry secretary. And I felt I was treated badly when I was told that I am not the only one who needs this type of surgery. There are people longer than me, and there's a firewoman waiting, and these surgeries cost $50,000. That's not my business.
Very exorbitant, yes.
That's not why I called.
Sure.
I wanted to know the status of
so
where
your waiting time, yes.
So that was just one aspect of it.
Yes.
Okay? Then we come now to the clinic experience of this Walk Maryland thing. I was a considered patient. Okay, I was under consideration for this.
Yes.
And I went to everything that they asked me to go to. Assessments by different doctors. I had to do X-rays of hip, ECG, blood tests, very comprehensive. Okay?
Yes.
And also an anesthetic assessment. And at the 99th hour, I received the phone call that I was no longer considered suitable. And if I wanted further information, I had to contact customer service. This phone call went to my voicemail because I did not get the phone call directly.
Heartbreaking and frustrating, I could imagine.
Putting it mildly.
Yes.
So I go into the hospital to speak to customer service.
Yes.
And customer service tried contacting the doctor who left the message. Couldn't get through. Got through to another doctor on the team and was told that I have to go back to clinic to find out the reason why I was not selected. Because I was just prepared to hear that I was not selected. I wanted to know why.
Of course.
I wanted to know, and I think that was my right.
Of course.
You
have my empathy.
I was exasperated to hear that I had to go back to clinic to find out why. And I told the person, I don't think I've taken this through, I think I need to go higher. So, and I contacted the medical chief of staff office and spoke to someone there and was told that customer service should have referred me to some other department. The name eludes me now, I'll remember in a little while. Okay? So they contacted that department.
Right.
And I was told that the head of the department will give me a call. Okay?
You didn't get that call.
Actually, I didn't get a call from any head of the department, but I got a call from the doctor who left the initial message on my phone.
Very good. Very good.
Okay?
Yes.
I appreciated them calling me.
Yes.
And we had a discussion on the matter. And he suggested, yes, you still need to go to clinic because you have to let them know that you are back on the local waiting list.
Okay.
So I go back to clinic.
So it's been a lot of stress and so on. Yes.
As I told the doctor in clinic,
yes.
The Minister of Health has already made a big thing about the cost of these replacement parts and how much the ministry was being overcharged for it. When you check the internet, it could have been purchased for $5 and the ministry was paying hundreds of dollars for it and so on and so on and so on. Okay? Again, that is not the patient problem or business.
Sure.
But ultimately, we are affected.
You're affected, and thank you very much for sharing that, though, with us. And I'm sure that those experiences are so common. Those experiences, unfortunately, are far too common within the public sector, and thank you for sharing that with us. So our final caller for the evening hails from Vista Bella. Good evening, and thank you for joining us.
Good afternoon, Doctor.
Thank you, ma'am.
I wanted to ask you a question. I want to know, I heard you talk just now something about our bacterial infection. What is that? Can you explain it more to me, please?
Thank you very much.
Thank you. You have a lovely shirt. I like your shirt.
Bless your heart, but good evening.
Good evening.
Yes. So there are so many germs or microorganisms, so these microscopic germs that may be found, and we've spoken about viruses, there are bacteria, there are fungi, and you have many other microscopic organisms that can cause infections. So, and when you have an infection, usually the body, especially if it's a mild one, the body will be able to fight it off for many of the viruses. But bacteria represent a different group of organisms. And you may find that even somebody who may have been admitted with a viral infection may actually acquire a secondary bacterial infection. So they are both at that point. Because, and certainly if your immunity is weaker, you are more prone to infections in general. Those are the types that respond to antibiotics. So as a reminder, though, that antibiotics are not recommended for viruses, but there are certain drugs which are approved and used for bacterial infections and even for fungal infections as well. Sometimes the doctor may actually want to identify which particular bacterium, so the singular is bacterium, the plural is bacteria. And the doctor may want to find a specific bacterium that is causing the infection. So he may send you for a blood test and see if it grows many germs in the lab. Or he may, if he thinks that your symptoms are indicating an infection in the urine, perhaps, he may send you for a urine test in the lab. And they can actually say which antibiotic is best for that particular infection. Sometimes, if we're not sure, if we don't have time, persons with life-threatening infections admitted to hospital require antibiotics straight off the bat. So we often use what are called broad-spectrum antibiotics to kill as many of the bacteria that we can think of or can find, especially the commoner ones that might be found in the community. So if your doctor thinks that you may have a pneumonia, that can sometimes be caused by bacteria as well, and he may want to send a sample of the cold from your chest called a sputum. He may want to send it and see if it grows any germs. And the thinking behind that is to use a specific antibiotic for a particular type of bacteria. All right, so what a fantastic time we've had so far on the show. And I would like to thank our callers and viewers once more. In closing, I usually like to end with an inspirational thought, and I have a video which I think would generate a lot of interest, perhaps a bit of a tearjerker. Let's have a look.
Total $68.
I'm sorry. Can I return the cake, please?
Sure, yes.
I want the cake, please. I won't ask for anything else.
Next time, okay, when we can afford it?
Last time you said that. The cake is not tasty. Let's buy something else, okay?
You don't want that? I'll take it then.
Okay.
Hey. Hello, this is for you.
No, we cannot accept it.
Would you please?
There's no reason for you to buy the cake for us.
Well, when I was 7, my mother wanted to buy me a cake.
Mommy, I just said.
By the counter, we didn't have enough.
Can we get something else?
It's my birthday today. Can I choose my own cake, please?
I'm sorry.
Then, there's this.
I chose this cake for your birthday.
Wow, this is my favorite. Thank you.
Let's go and put some candles.
Oh, careful.
He shouldn't have spent the money.
Actually, Kaiman paid for it.
He give me this note.
Please write down your address. I'll bring the money back to you later.
Just a reminder about the spirit of love and caring in the coming week and months. Thank you to our splendid callers and viewers, brilliant IBN crew, and supportive studio audience. God bless you and enjoy the week ahead.